Hello, I'm your host, Neal Howard, here on Health Professional Radio. Thank you for joining us. Our guest is Dr. Gary Small. He's Director of Geriatric Psychiatry at UCLA Longevity Center and the UCLA Brain Institute. And in addition to that, he's also a New York Times best-selling author. And he's joining us on the program to talk about some recent research findings concerning Alzheimer's disease and how those findings impact caregivers and their families. Welcome to the program, and thank you for taking the time, Dr. Small.
My pleasure to be here.
A bit of background about yourself.
So I'm a geriatric psychiatrist, and I've been working with patients with Alzheimer's disease and their families for several decades. And I've helped them deal with this really challenging illness. And at the same time, I've been a principal investigator on multiple studies supported by the NIH and foundations trying to understand this disease better, how to diagnose it earlier, and how to treat it more effectively.
Is there a personal connection to Alzheimer's that maybe got you interested, or is this something that you'd been interested in since you decided to become a doctor?
It's something that I got into in part because I was interested in the interplay of the mind and the body during my psychiatry training, which led me to geriatrics. And once I got into geriatrics, I realized how important loss of memory was in terms of a public health issue. But more recently, I've seen it in my own family, and it's really brought me much greater empathy with my patients and families that I deal with, because it is a tough disease, and it's not just an illness that affects the patient, it affects everyone around the patient.
Is Alzheimer's a guarantee as you get older if you live long enough?
That's a question that I think science has not yet been able to answer. It's clear that age is the greatest single risk factor for developing Alzheimer's dementia. At age 65 or older, the risk is about 10%, but by age 85 or older, it approaches 50%. And we've found in our imaging studies, and it's been backed up by pathology studies, that subtle evidence of Alzheimer's disease accumulates in the brain decades before symptoms are obvious. So that generally frightens people, the thought that Alzheimer's is silently growing in their brains. But the good news is that if we can detect the problem early, we can have a greater impact. I'm convinced that it's easier to protect a healthy brain than try to repair damage once it's extensive.
What are some of the methods employed to detect early onset?
There's a standard approach doctors use where they do a good physical examination and a thorough history, so they find out the nature of the symptoms, do screening laboratory tests, because a lot of times dementia can be caused from depression, medication side effects, and at times it can be reversible. But even if it is Alzheimer's disease, there are medicines that temporarily stabilize symptoms. They don't cure the disease, but they do have an impact and keep people functioning better longer. And the other piece that we're learning more about today is that everyday lifestyle habits, behaviors that we engage in every day do have an impact in our brain health, and they appear to stave off symptoms of the disease, sometimes for even years.
So are we talking repetitive activities or just something that a person enjoys doing when they're not dealing with Alzheimer's before the dementia sets in?
There is what I've called a formula for successful aging that involves essentially four things we all can do for ourselves.
Great.
Physical activity, mental exercise, stress management, and proper nutrition. And basically what's good for your body is going to be good for your brain.
Now, the recent study that we're talking about, does it address any of the Alzheimer's facts concerning men and women? Who is more likely, even with age being a factor? Has any new light been shed on that?
We still have more to learn about the sex differences in risk and treatment. We know that women are at greater risk than men, in part because they live longer and age is the greatest risk factor, but there are likely other factors, biological factors, perhaps social factors, that put women at higher risk. But we don't fully understand that as yet.
We talked about Alzheimer's not only affecting the patient to a huge degree, but also caregivers and family members. Is there anything in these findings that can benefit the caregiver or the family member when dealing with someone who's got Alzheimer's?
Well, we know that people who are primary caregivers of dementia patients are at risk for depression. At least 50% of them develop a depression that requires medical intervention. So it is clearly problematic. And what we're finding is if we can treat the patients more effectively, it's easier on the caregivers. What happens as the disease progresses, patients often develop more behavioral problems that are truly troubling for caregivers. The patients become aggressive, they become inappropriate, they get psychotic, and it's very difficult to handle.
Mentioning depression in caregivers and family members, have you noticed or come across or heard of any instances where a person is giving care to a father or mother and they themselves are a candidate for Alzheimer's, being that silent attacker, as we talked about? Have you noticed that maybe onset of depression in the caregiver is accelerated because of their depression in dealing with the severity of that family member?
Well, you bring up a lot of issues because these phenomena seem to connect to each other. Mm-hmm. We know that untreated depression is a risk factor for cognitive decline. We also know that depression is in some ways emotionally contagious. If you're around depressed people, that makes you feel depressed if you have any capacity for empathy. So if the caregiver is depressed, that's going to bleed into the mood of the patient, and they're going to do worse cognitively and vice versa. So I think it's very important to deal with depression. We do have effective treatments for depression. It needs to be recognized and treated just as we need to recognize and treat Alzheimer's dementia.
Your book, The Memory Bible, who is that book directed to? Is it directed more toward the caregiver, the family member, your colleagues, or the patient, or is it a combination of all of those put together?
The audience that we wrote for primarily were the millions of people who are noticing age-related memory slips, which is just about everybody by the time they reach their mid-40s. So if you have reached age 45 or older, you probably misplace your keys or you forget someone's name whose name you should know, and you may just laugh it off, make a joke. Or if you have a family member with Alzheimer's, you may be more worried about it. So I think it's really something for everyone. Certainly if people already have dementia, the kinds of memory techniques that we teach in the book and others we've written since are not going to be as effective. So again, the reason that we think early detection and intervention is so important.
Now, where can we go online and get some more information about the recent study, some of the treatment options that are available out there, and a copy of your book as well?
So I would, not only the Memory Bible, but my most recent book, 2 Weeks to a Younger Brain, you can find on my website, drgarysmall.com, drgarysmall.com. Recent study is available in a lot of different websites. You can, there's information on AARP staying sharp. There's a lot of information there. You can go to the UCLA Longevity Center website. Alz Forum has some wonderful new research out there, the Alzheimer's Association. So there are many resources online and also in person to help people who are struggling with this condition.
Dr. Small, it's been a pleasure. Thank you so much for joining us today here on Health Professional Radio.
My pleasure. Thank you for your interest.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm.